I'm Dr. Malik. Today we'll talk about an important topic. Recently, 3 to 4 days back, I was a young girl about 10-year-old, just completed 10 years, was brought to me by one of our sisters. The sister happens to be her relative. The girl was brought to me saying that there is a 10-year-old girl. She has a small mass here over the back, over the spine, small mass which is very soft, small mass, very soft. And I examined her and it was only fat. It was only fat. After getting x-ray also, we have x-ray, ultrasound we have done, it was nothing but fat. It will disappear. So this girl has unnecessary unwanted fat disposition everywhere in the body. The baby was about the girl was just about 10 years completed, and the very look of the baby, the look of the girl is she's about 45 kg. She's about 45 kg. She's active though. She's 45 kg and definitely overweight, and she has got black skin over the neck, particularly over the neck. We are able to, the girl itself is light dark colored girl, but you can clearly identify a dark neck skin. All around is dark, very black. This is what we call acanthosis nigricans in metabolic syndrome, in hyperinsulin states, in particularly in adults, particularly when in 35-year-old, 40-year-old females or males, you find this black colored skin over the neck with small, tags and all, skin tags and all. This is typical of hyperinsulinism and hypothyroidism, hyperinsulinism, insulin resistance we see. But this is very young age. She has just completed 10 years. And see, after investigations, we found that she's hypothyroid. Of course, see, in pre-pubertal or puberty age group, particularly girls when they are reaching their puberty age group, thyroid is a very common problem. That is almost, we can call it physiological goiter. But the thing is, this girl has very high levels of very low high levels of TSH. That means thyroid is functioning very minimally. TSH is very high. That is, thyroid stimulating hormone is very high, means thyroid is not functioning properly, hypothyroid. She's grossly hypothyroid. We had to put her on hypothyroid tablets, thyroxine, etc. But what this girl is going into is metabolic syndrome. Very engaged. 10 years is very engaged to land in metabolic syndrome, which I was talking before. Previous topic on metabolic syndrome I did. Please try to see it. What is that? Particularly, metabolic syndrome is a result of hyperinsulinism. In the body, there is very high levels of insulin. That is the reason. And body is resistant to insulin resistance. Why? The reason is, in India, about 3 to 4 people in 10, 3 people out of 10 are diabetics, and rest of the 3 to 4 people are pre-diabetics. That means the sugar levels are normal, but the insulin is very high. That is what is hyperinsulinism or insulin resistance, and they land in metabolic syndrome. You must have seen nowadays all these features: obesity, males and females, they are engaged, they are obese, and they are all pre-diabetics. And PCOD you are seeing routinely. That is, there are small cysts in the ovaries. Is there in bilaterally, both the sides in females. In males, you are seeing infertility, and PCOD also causes infertility in females. Yes, and hirsutism, unnecessary hair over the face and all in females. You must have seen it. Atherosclerosis. What is atherosclerosis? Atherosclerosis is nothing but your blood vessels are getting thicker. There are plaques inside the vessels. The blood vessels are become thicker and thicker day by day. They are no more soft. They are very thick, very dangerous, they have become like very much used water pipes, thick, and they are not flexible. That is called atherosclerosis. Inside there are plaques, they are called atheromas. Inside there are plaques. So there can be chances of early heart attacks, early MI. So acanthosis nigricans, I told you, this dark neck. Over the neck you see dark patch, big dark areas. Completely the neck is black. Even though the patient is fair skinned or light dark skin, whatever it is, but here it is extremely dark. This is called acanthosis nigricans. Insulin resistance, hyperinsulinism is the cause. And hypothyroidism, all these people are 90% hypothyroids, and they are diabetics also, pre-diabetes or diabetics, leading to hypothyroidism. Next comes hypothyroidism, and infertility is a routine thing. And one more thing is why? What is the reason? What is the reason for this? Is consumption of high sugars. They are taking sugar daily in whatever form, in cool drinks, in whatever form. I'll tell you, high consumption of sugar should not be taken at all. Don't take any sugar in any form. Number two, no fiber in the diet, and no fiber in the diet. And most important is they're consuming lots of carbohydrates, which are simple carbohydrates. That means these bakery products, packeted products, and everything, ready-made available foods in the stores and all. They are the reasons for it. They are all simple carbs. The moment you put inside, the moment you put inside, they are immediately converted to glucose, and insulin has to produce. The pancreas has to rush and produce insulin, high levels of insulin continuously, and they are taking food almost every couple of hours or every hour, some snacks, something. Insulin is being produced continuously. There is high levels of insulin, and there is insulin resistance in the body. This is called pre-diabetes, and ultimately they will land in diabetes, hypothyroidism, metabolic syndrome. So this is the condition. So one more thing about these foods. These foods are not only dangerous, causing metabolic syndrome, they are causing very big damage to the intestinal bacteria. From mouth to the anus, there are very good bacteria, very friendly bacteria, which are most important, and these are the main culprits. These foods are the main culprits. They disturb the bacterial colonies, which are very helpful to us. They disturb them, and they create unnecessary dangerous bacteria also. See, these bacterial flora, please see my video, gut microbiome, bacterial flora, how much they are important in maintaining our body. Normal biochemical reactions are total. All the biochemical reactions and biomedical reactions, these are very important. They disturb. And the number one, how to reverse this girl, we have started treatment for her as far as hypothyroidism and all is concerned. That's a different issue. But how to reverse this girl? Number one, 80:20. Probably the girl is not getting enough exercise. So 80% the girl should concentrate on diet, 20% she must concentrate on exercise, some playing or something, some games, something. It's outdoor games. 80% is on the diet and 20% is on the exercise. And intestinal flora of bacteria, they must be replenished with very good diet, particularly fermented foods in our house. We used to eat fermented foods in our house, particularly curds and all. And not only that, we used to eat fermented food also. In the night we used to cook, in the morning we used to eat, next day morning we used to eat fermented food. This is very important. And one more thing is, avoid rice, avoid wheat, avoid maida, avoid all outside available oils. The oils which are available in stores, please try to avoid them. And cool drinks, absolutely stop cool drinks. No cool drinks at all outside. And juices, outside available juices, you must stop. You can make juices at home, that is better. Along with the pulp, you must eat pulp also. Juice should be with pulp and no artificial sweeteners or no sweetening at all, no sugar at all in it. Take juice as it is with the pulp. You can make juices at home. Don't take outside juices because they are adding so many preservatives and sugar also they add. Please avoid. And cool drinks, immediately stop. So one thing is, and come back to the diet. In fact, if you can't avoid rice, okay, take rice. Rice, the problem with the rice is it has got very minimal fiber, only 0.1 to 0.2. So if you say that I cannot avoid fiber, I cannot avoid rice. Okay, if you are not able to avoid rice, at least take some rice which has got very high fiber content, less polished or not polished at all. Okay, that also I am against. Okay, and wheat, particularly if you can't avoid wheat, maida you must avoid it completely. Oils must be only cold pressed oils. Ghee is the best medium for cooking. Number 2, coconut. Coconut oil is the best medium for cooking, and rest of the peanut, till oil, etc., cold pressed, not bottled, outside shop oils. Please don't take. Avoid rice and wheat. If you say that I cannot avoid rice and wheat, okay, please, rice you take as much as unpolished rice, completely unpolished rice. Rice itself has got very low fiber. Please try to shift to millets. But rice is very low quantity of fiber. Take unpolished rice if not possible to stop. Okay. And wheat, particularly wheat, people take wheat flour. Don't purchase wheat flour outside. Don't purchase wheat flour in shops. Please try to take wheat as a whole grain, and you go to the flour mill and you get it into flour. Please don't do this. Don't do that filtered one, because you need to have fiber. All the wheat flour which is available in shops, there is all filtered, so no fiber in it. Please, you take wheat, you purchase wheat, you go to the flour mill, you get it done. But as such, it is better to avoid wheat and rice. You please shift to millets. Oils, I am very clear. You can take ghee, coconut oil for cooking, and number 3, all for example peanut oil, for example groundnut oil, etc., but cold pressed, not shop oils. And non-veg you can take liberally, but again oils should be very careful. Vegetarian you can take in anything except say some things like aloo. Don't take much of aloo and all, because they contain a lot of carbs. So try to avoid those things which are full of carbs. Little try to avoid. Don't take daily aloo. Mainly that oil, aloo. And millets is my first choice. 9 to 12% of fiber. 9 to 12% of fiber in millets. 5 types of millets, as I told you earlier, and as Dr. Kadarwali says, please 5 types of millets, 2 days like that. Pulses you can take liberally. Chane ki dal ho, kuch bhi ho, you can take pulses as a whole grain, please, please take pulses as a whole grain. Pulses are very good. And non-veg very liberally you can take, veg very liberally you can take. Try to take these things, because even in very young age, 10-year-old girl going into metabolic syndrome, just think, she's landing in infertility, she's landing in diabetes, she's going to land in MI, and all the problems at a very young age. Try to avoid all these things. My request is, please, 80% think of diet, 20% think of exercise. In whatever state you are, you may be passing through a depressed state, or whatever state, or you are happy, depressed, whatever it is, that is personal. But concentrate on your diet. 80%. Don't damage your physique, don't damage your body. So 80% it is diet, 20% it is exercise. At least half an hour per day, try to do some sort of exercise. Okay, and try to save your intestinal bacteria by taking fermented foods and fruits liberally, because all the fruits, they contain healthy bacteria. So fruits, ripe fruits, please take. And particularly try to take fermented food like our ancestors used to take, we used to take in childhood. Even now I am taking fermented millets, cooking millets in the night and taking them in the morning. That's the best breakfast. What is the best breakfast in the world? Is millet fermented breakfast. That's what I have done a topic on it also. What is the best breakfast? Please try to follow this. You will not land in such problems. And landing in these problems at the age of 10 is not to be advised. Future is full of problems, and try to avoid these ICUs and all. There is nothing worse than ICU.